Welcome back to Easy Medical Learning. This is for you. If you're here and you just got to this channel today, this was intended for you. My name is Cheryl Williams and I am a physician. I'm an acupuncture physician. And my thought and my hope is to help you to successfully and positively pass your board exam. I'm covering these particular herbs. You will find out why these are the most important. I stressed that earlier. If you want to check back into my videos, the importance of knowing these herbs in particular. So welcome back if you're coming back to the channel. And if you're coming now for the first time, thank you for coming. Today we're going to have an overview, and don't worry, I'm going to have a slide so it's clear when I'm saying a certain herb that you're understanding what I'm saying. But just a little overview. We understand that the exterior releasing herbs are the first in the category. You have warm, then you have cold in nature. So certainly I have set this up to do 2 herbs at a time and for you to compare it so you're understanding it in a gradual way. And finally, the bell in your brain will click off. From what you learn in school to this is a preparation for a test. This is the most easiest way to learn and understand, to apply it for a test purposes. So here we go. Exterior releasing warm, pungent herbs. They are typically for the lung and the UB channel, but there are some exceptions. Most of them is for the lung. And as you know, this is a superficial condition that a person may have. So if we're going over the warm, pungent, acrid herbs, that means the patient's condition would be that they have wind cold and maybe other situations, as you're going to find out. The 2 herbs that we're doing today is Z-C-Z, Z-I-S-U-Y-E, and you know Y-E means it's a leaf. The other one is Jing, J-I-N-J-I-E. I want to be very clear so you're understanding this. Now, both those herbs, they are acrid and they are pungent, but there is a difference. Jing is slightly warm, whereas Zi Su Yi is just warm. Both of these herbs does go through the lung channel, but Zi Su Yi goes through the spleen and lung. Zheng goes through the lung and liver, and there is a reason for this. This is going to show you why. For instance, Zi Su Yi, that does release the exterior, but it also induces sweating. Pay very close attention. It is for wind cold syndromes. But Jing, it is for releasing the exterior, but it doesn't have any effect about the inducing sweating. It dispels wind. That's another way of saying it because of the type of conditions that you're going to find and you're going to observe. Very important keynote to observe that the middle jiao is where most of the problems are associated with Zi Su Yi. For instance, it's moving qi. So just consider it resolves seafood poisoning. It deals with nausea, vomiting, poor appetite. You have the information. I'm just going over it, and I'm going to show you in the slide what I mean. And it also does deal with restless fetus and morning sickness. So therefore, that's an indication to you that it has something to do with maybe a person that's pregnant. And the other one about seafood poisoning, that is very important. I'm going to have to show you, though, the differences in which type of this particular herb you'd use for this condition. On the other hand, when you're dispelling something, dispelling wind, that has a lot to do with things pertaining to your skin. And that's why you'll have liver, because it deals with itchy skin, measles eruptions, things of that nature, and carbuncles. But pay closest attention. Jing is an auxiliating herb. That's for hemorrhaging, to stop the bleeding. But you've got to use it in a charred way. That herb needs to be charred. So I've just shown you the difference in a very small, minor way. We're going to go through these herbs. What I'm asking you is to please trust me. I know what I'm talking about in terms of what is the focus for a test, to understand the differences and the similarities. After a while, you will get it. So the herb that had to deal with the lung and the spleen, that's in the exterior releasing, pungent and aromatic, warm, that is Zi-Su-Yi. And again, that is for wind-cold syndrome and inducing sweating and releasing the exterior. Another very important thing to note is Jing, Jingg, Jie. It is used for both wind cold or wind heat syndrome. You've got to know that, because this is something that is very crucial to understanding this herb. Exterior releasing herbs. 2 herbs we're covering today: Zi-Su-Yi versus Jing. They're both warm, pungent, and they are exterior releasing herbs. As you know, for exterior releasing herbs in the warm category, or exterior releasing herbs that are warm and pungent, they're used mainly for wind-cold syndromes. The pathogenic factor is superficial. It hasn't entered the skin. It has not been lodged in the body. It's superficial. So one of the main ways of releasing the exterior is by sweating. The person typically would have an aversion to cold. Again, this is warm, pungent herbs, flowing pulse, or slow pulse, or white tongue coating. Typically, it's the weather condition that would be most profoundly the reasoning for this factor. In general, you find in most of the categories pertaining to exterior releasing herbs is diaphorics, meaning sweating, reducing fever, pain, inflammation, and it has an antiviral and an antibacterial pharmacological action. As a pleasant reminder, again, the exterior releasing herbs, it is for sweating, releasing the exterior, and also moving qi. We're going to compare and contrast 2 herbs. The first herb that we're doing is Zi-Su-Yi. As I said, Y-E means leaf. This particular herb is pungent, warm, and aromatic. Pungent and warm are the typical things you'll see when you're dealing with the warm-natured herb. that are exterior releasing. What you may find sometimes is some are aromatic, some may be bitter, some may be sweet. In this case, this is aromatic. This also, it covers the lung and the spleen channel, and you'll find out exactly why it would cover the spleen channel in addition to the lung. Remember that the lung is where we're getting the idea about the exterior releasing most profoundly in the sweating in a superficial condition. As you could tell on the screen, I don't have a lot of words on there. There's a reason, because you need to look at this very clearly. Zisui, like I said, YE means leaf. It does resolve seafood poisoning. I'll say it again, seafood poisoning. That is very important for you to remember, and that it does in fact move qi. This herb, zisu, it could be zisi, which is a leaf, and then you might see zisugin, and they're referring to the stalk. That type of that same particular herb, but it's from the stalk, that is the one that deals with the fetus, calming of the fetus. The leaf, however, that deals with the seafood poisoning. So I'm showing you clear information. Zisui, it's warm, it's pungent, it's aromatic, it induces sweating. That's very important here because you're going to find out something. And it also releases the exterior. This moves qi, and it's basically expanding the middle area of the body. And of course, if you're having seafood poisoning, that would be the area that would be most affected in that particular situation. Zisui is for wind cold syndrome. It is also for nausea, vomiting. If you're noticing, this covers the lung and the spleen channel, so it is no accident why this particular herb, it is relatable to the middle expanding of the middle. Let's go forward with this. Nausea, vomiting, you having poor appetite, restlessness, morning sickness. Now that I would think with a pregnant woman, that's what comes to my mind if you see it in the test question. And then the abdomen, which is in the middle, that's where you get a lot of the vomiting from and the seafood poisoning. Now, 30 to 60 grams, it's what the amount is if you're combating seafood poisoning. Very important. Zisui, it could be decocted in water, and an oral dose is 3 to 10 grams. This is just in general. I already covered what you need for seafood poisoning. This is just in general. The contraindication or the caution for this particular herb is if the patient has sweating. Because if the patient is sweating, this would be somewhat of a caution as to maybe how much you should use. Just consider it this way. This is the warm, acrid, pungent, exterior releasing herbs. So that is one of the typical caution and contraindications. It's right here in front of your screen very clearly. Zesu, the leaf is when you put YE at the end, and that's the one for inducing sweat and for poisoning. And that is why it's a caution. So if the patient is sweating, well, then you wouldn't want to utilize it as much, because this does induce sweating, and it is also for seafood poisoning. The same herb that we're talking about, but now this is the stalk of the herb. This is where you're understanding the difference, that this would be used for calming of the fetus. So you'll have ze suging, or you might see sugin. That is going to let you know that that is for calming of the fetus, and that refers to the stalk. Here's a list of some of the pharmacological actions for that particular herb. It's sedative, it's antipyretic. That means if a person's feeling feverish, it improves the digestion. Remember what I said about the middle. Increase blood sugar, anti-cancerous. You could read, I'm sure you could see what's being said here. It does have a nature, however, to help to stop bleeding, and it's an anti-coagulant. So I'm going to show you how this is very, very important, but you don't have to remember every single thing. This is just something I'm doing just to show you. This is the next herb we're covering, is Jing, pungent, warm, but it is slightly warm, and that's very important. It is aromatic, however. This particular herb, very important to know, it is also helpful for wind cold / and or wind heat syndrome. So it's doing two things. The other herb that we just communicated about, Zisuyi, it's only for wind cold, but this is another herb, Jing, which is wind cold and wind heat syndrome. That's very important, very special. This herb also, it does go through the lung channel just like the other herb, Zisuyi, but this is for it goes through the liver channel, and you'll find out that it's because this one has a lot to do with conditions that may be of a nature where it's mostly affecting the skin, that is visible to the skin. And because it's slightly warm, that's why it would be considered to be used for the wind cold condition and the wind heat syndrome. Dispels wind and releases exterior. Dispel means dealing with the skin, getting rid of, pushing out in that manner. Jing, it's either in a stem or a bud form. You don't really need to know it. You just need to be mindful. I'm just trying to be extremely thorough with you. Again, it does release exterior. If you notice, it doesn't say anything about induced sweating. Release exterior, dispels wind, vent rashes. Like I said, think of the skin. Think of liver channel. Think of lung. Alleviates itching, but this is another important thing that really doesn't have anything to do with the skin, but it does in a way. It does stop bleeding. Okay, so we got it. You could use it with wind cold or wind heat syndrome. Very important. And this herb, Jing, is also an auxiliary. On your tests, you might need to know auxiliary means what herb could be used with other herbs for hemorrhage. And we all know that means bleeding. However, it has to be charred. Please keep this in mind. Very important. Jing, again, should be 3 to 10 grams deconct water for all usage for the exterior syndrome. And if you're going to be using it for the bleeding as the auxiliary herb, remember it's a herb that you add with other herbs to make a formula. It should be stirred, baked to charcoal or charred for bleeding. That means stop bleeding. There's no contraindication or caution for Jing. A review. Jing for wind cold, and both wind cold, wind heat, for skin eruptions, and it's the beginning stage of measles. Now let's compare these two herbs. Suzhi and Jing. They both are aromatic, they're pungent, they both release the exterior, and they both go through the lung channel. But like I said earlier, one of them, which is Zhi, it induces sweating, whereas with Jing, it dispels wind. Very different. So these two herbs release the exterior, it goes to the lung channel, it's aromatic and it's pungent. All right, it's very important that you listen to this video again. Here are the differences. Zhi, it goes to lung and spleen channel, whereas Jing, it's not on the screen, but I'm telling you, it goes through the lung and liver channel. Zhi, it induces sweating, it releases the exterior, and it's only for wind cold syndromes. It does move qi. It deals with poisoning. As I said, it deals with seafood poisoning. It expands the middle. It deals with the fetus and morning sickness. Comparing Zhi to Jing. Jing, it releases the exterior, just like Suzhi, but it does not have anything with inducing sweating. It dispels wind. It refers to itching, venting, rash, and it does stop bleeding. Let's summarize this. Which herb calms the fetus and it deals with morning sickness? You're correct if you figured out is Zhi. Which herb helps with dispelling wind? It's both used for wind cold and wind heat syndromes. That would be correct. It is Jing. Jing is slightly warm. Auxiliary, very important, because when you're thinking about formulas, they're going to ask you which herb could be used as an auxiliary herb for hemorrhage. That means that you could add it to the other herbs to make the formula. You would have to say the answer would be Jing. Jing also deals with boils and carbuncles with exterior syndromes. So we're understanding clearly one herb, they're both in the warm category, exterior releasing herbs, but they're behaving differently in the sense that one goes through the lung and spleen, the other one goes through the lung and the liver. And the one that goes through the lung and liver is the one that you're looking at the bottom, which is Jing, and that's why it has a lot to do with dispelling wind. That's why it has a lot to do with the fact of carbuncles. Just think about it. I'd like for you to consider the possibility of using the videos by listening to it repeatedly when you're on your way somewhere. Because like I said, I'm covering the main things that's very critical for understanding this in a testing way. That's why I'm putting up 2 videos at a time. Or I should say, why I'm putting up 2 herbs at a time. It is very, very efficient in order to memorize this information. And soon before you know it, you'll be able to understand it and recognize it very easily just by listening to this repeatedly. Like I said, I studied here in Florida. That's how I got my license. And I don't know what school you're at, but if you walk in the hallway, you might see my picture, because I called the school and they said it's out there still in the hallway. It's been my pleasure helping you to reach your success goals. If you think this video has been interesting and have some level of value, please click the like button. Take care. And I'm encouraging you to leave a comment. Let me know where you're at, in terms of your tests, preparing for your test, which one you're going to take first. Please feel free to do so.